Hello, my name is Jasmine Flores, and today we will be talking about Meniere's disease. We will be discussing a little bit about it, what it is, how it's treated, and a few complementary therapies that can be used to treat the symptoms. What is it? Meniere's disease is a problem caused in the inner ear that has symptoms such as hearing loss, tinnitus, which is the ringing in the ears, and vertigo, which is dizzy spells. So the dizzy spells usually feel like spinning that usually lasts anywhere from 20 minutes to 12 hours. And tinnitus is the ringing in the ears, which is just hearing a ringing in your ears. Hearing loss can also happen, and it can come and go, but it usually does happen early on in the symptoms of Meniere's disease. There is no known cause, no specific known cause, but it is thought that extra fluid in the inner ear could be the cause of Meniere's disease, though it is unknown. And usually only one ear is affected, not both of them at the same time. There is complications that can come from it, like getting vertigo attacks, and there is the possibility of losing your hearing long term. If it also usually starts between the age of 40 and 60, and it does tend to be a lifelong condition. There is no. We ask ourselves, how is it treated? There is medication that can be taken for the different symptoms, such as vertigo. You can take motion sickness medication, anti-nausea medication, and it can also be treated by a change in diet, such as restricting the amount of salt that is consumed. Cognitive therapy can also be used, and behavioral changes can be used to treat the symptoms, such as sitting down or lying down whenever you're feeling dizzy, resting, and preparing for the symptoms that come with Meniere's disease. There's also antibiotic injections, such as gentamicin, which can be used to treat Meniere's disease. There's also surgery, such as an endolymphatic sac surgery or labyrinthectomy. Alternative medicine can also be used. Complementary therapies consist of acupuncture, craniosacral therapy, and nutrition changes in nutrition. The role that nutrition plays in the symptoms of Meniere's disease is important. It is recommended that uh, someone with Meniere's disease takes on a low sodium diet. This is because sodium can cause fluid retention. There should also be a limit on the amount of caffeine. MSG should also be avoided because it is also a type of sodium, and it is usually in stuff like the ramen noodles or Asian foods. Acupuncture is another form of complementary therapy that can be used for Meniere's disease. It is said that the feeling of having a clogged ear is a buildup of phlegm, that causes an obstruction of the flow of qi. So with acupuncture, it would clear the qi energy, the blockage of the qi energy. And specific points are chosen when the acupuncturist listens to certain symptoms, which can tell them what is wrong. Craniosacral therapy is another complementary therapy for Meniere's disease. It is used specifically for the treatment of vertigo, and it is a non-invasive physiotherapy treatment, and it is performed using light touch. Here we have the works cited, which includes 4 different web pages that I was able to get my information from.